in New York City, new cases and pediatric hospitalizations continue to grow, and many parents are wondering how to keep their kids from getting sick. So to address this, the city has revamped its COVID testing policies to try to keep kids in school. CNN's Alexandra Field joins me now. So what's this new testing plan, Alexandra?
Hey there, Allison. Look, the idea here is that city schools want to be able to catch cases more quickly, but they also want to be able to put kids back in the classroom faster. The city saying that schools really are the safest place for children to be. The new testing plan aimed at keeping them that way. So what they're doing is they're relying on these at-home test kits. They say if they have a positive case, they'll be giving two kits per day for 7 days to all the children in that classroom. In order to get back to the classroom, you will have to be asymptomatic and to have two negative tests in a row. You can then return the next day. So this is a balancing act. We're going to be seeing school districts across the country doing this, just trying to figure out how to identify those cases and take care of them through these testing mechanisms. On top of these rapid at-home tests, they're also going to be doubling the number of PCR tests that they perform in city schools as another layer of protection here. But really, the mayor-elect is saying he believes schools are the safest place for kids to be. And this is some proof that the city is really committed to keeping kids in the classroom, even amidst a surge that has led to a rising number of cases, not just in adults, but of course in children, and also this rising number of hospitalizations. It's something the city is experiencing firsthand, a five-fold increase in pediatric hospitalizations in New York City in just the last 3 weeks. It's alarming when parents hear that, but Allison, we also have to keep in mind that the number of children who are hospitalized, while it is going up, remains extremely small relative to the number of adults hospitalized with COVID.
Right, and we also do want to find out what their symptoms are once they're hospitalized, how bad it is right now in this current wave, and we're about to get to that. So Alex Field, thank you very much for all of that. So with me now are two doctors on the front lines at children's hospitals. We have Dr. Claudia Hoyen. She is a pediatric infectious disease specialist at UH Rainbow Babies and Children's Hospital. And Dr. David Kimberlin is co-director of Pediatric Infectious Diseases Division at the University of Alabama at Birmingham. Thank you both for being here. I know how busy you are. Dr. Hoyen, first, as you just heard, millions of kids across the country are scheduled to go back to school on January 3rd, 5 days from now. Is that a good idea?
At this point, as I think was just noted, there's a lot of variability around what different parts of the country are seeing. I know here in Northeast Ohio, we're a little bit behind places like New York, New Jersey, Houston, in that we were still kind of getting over our Delta surge since we were the last to surge with Delta, as we are now coming in to this Omicron variant surge. And so I think that, again, we know how to keep children safe in school. We know that masking is effective. And if, kids are symptomatic, of course, they should stay home. If they've had an exposure, if you're able to do testing, again, there are many layers that we can add to keep children in school as we move through the next few weeks. As we know, it's not only the safest place, but it's the place that they need to be. The last 2 years have really taken a toll on our children, and so we all need to do what we can, whether that's getting vaccinated, making sure we're masking. Here in Ohio, the Ohio Children's Hospital Association today actually sent a letter to the governor and to all the school superintendents, thanking those school districts who are continuing to mask and asking respectfully that as we're bringing kids back to school in the middle of, rising numbers of Omicron here in Ohio, that they also consider having masking in those schools as well.
Because I know that a lot of places in Ohio have dropped the mask mandates. So, Dr. Kimberlin, to you, you're in Alabama. Do you still think that, as we've just heard from Dr. Hoyen and we heard from Alex Field, so many people keep saying schools are the safest place for kids to be, but with this rise, exponential rise in cases right now, do you think schools are still the safest place for kids to be?
Well, much of what we know, obviously, is based on on our prior experience, and Omicron is brand new. So I think we have to start by recognizing that Omicron is an entity that we will be learning a lot more about over these next handful of weeks. Now, that said, I think you've got to also draw on the experiences you've had in the past, and we simply have seen over and over again that schools can be open safely with prior variants of the virus and the original virus, and really spread within schools can reflect the broader spread within a community, but they're not really the nidus or the starting or the hot spot for spreads within communities, generally speaking. So that's point number one. Point number two is that we have a couple of really good studies now, California and I believe Illinois, taking an approach of test to stay, basically. And so what you do there is similar, I think, to what New York is trying a variation on, and that is to be tested. And if you test negative, if you've had an exposure and you test negative, you can come to school that day. And you test the next day, and you do that for a certain number of days, and try to get people in the classroom and staying in the classroom. And I really do think, I agree with Dr. Hoyen, you know, children have taken a beating with this virus and this pandemic, and they need to get back in school, and they want to be back in school, and that's where we want them to be as well.
I want to hear from both of you in terms of what you're seeing in your hospitals. You are on the front lines of COVID cases in kids, and the head of the CDC, Dr. Rochelle Walensky, said something interesting this morning that got all of our attention in terms of whether kids are showing up at the hospital because of their COVID symptoms or because it's an incidental pickup once they're at the hospital. So let me play that for you.
This is a common time of year for children to be admitted in the hospital. And some of the things we're seeing in the trends is they're not heading to the ICU more often, that we can tell. Many of them are actually coming in for another reason, but they happen to be tested when they come in and they're found incidentally to have COVID. And third, and really importantly, most of those children are not yet vaccinated.
Dr. Hoyen, does that track with what you're seeing?
Yeah, I think, again, like I said, in Northeast Ohio, we are just a little bit behind the curve in terms of what other places are seeing. So I think that what we're seeing still at our children's hospital, and as we go through the next week, as Dr. Kimberlin said, we will be learning a lot. We do have children who are in the hospital simply for COVID. We have children in our ICUs with COVID. We do have a couple of kids who have incidentally tested positive. So it may be that kind of start of the Omicron that we're seeing where kids might be relatively asymptomatic. But again, it's too early for us to know the exact course of what will happen in children. And, we'll be keeping in contact with our colleagues around the country to be sure that we're doing all we can to keep kids safe while they're here.
How about you, Dr. Kimberlin?
Well, across much of the South, our Delta wave receded by the time we got toward the end of October, very beginning of November. So we had a pretty nice period of a handful of weeks until just after Thanksgiving. And now, in terms of at least cases, not necessarily hospitalizations, but our cases are, it's almost a vertical kind of line. And so really, it's something that I anticipate will have a lag period, and we'll start seeing increased hospitalizations as well. Even if Omicron is a little less or somewhat less severe compared with Delta, as an example, it is so much more infectious, and therefore so many more people are getting infected. Our positivity rates in our emergency room at our children's hospital have increased 7-fold in 2 weeks. And so even if there are not as many being admitted in terms of likelihood per person, you get such a large number that you're going to have more people admitted. And so we're waiting for that. As Dr. Hoyen said, we're watching anxiously. That's a nervous anxiousness to see what comes.
Dr. Hoyen, did you want to quickly add something?
Yeah, I just was going to say, to his point exactly, it's as if, we're watching that train come down the track, as I think I said this the other day, and not trying, hoping it doesn't derail. Just the sheer number of children getting infected, even if a smaller percentage of those children get sick, it still could be very overwhelming for children's hospitals. So again, we wait anxiously, we prepare continuously, and we are ready for whatever comes our way.